every time we ask people not to come to the emergency, we also mention that if you feel sick, if you're not well, we are there for you. We're sorry if that wasn't clear, but people have to understand we are there for the sickest patients all the time, 24/7. Secondly, most people making those comments are from other provinces, Ottawa, Vancouver. I don't think they're facing 200 and 250% congestion. I don't think they have waiting room of 110 patients, and they don't see 50% of their waiting room leaving without seeing a doctor. So yes, it's definitely not something we want to see when you're 100 and 120%, but in face of the congestion we're facing right now, we decided to ask everybody to help us a little bit. We made that message to the population. The people, I can tell, emergency doctors agree with the comments that it's not by having less viruses in the waiting room we're going to decrease the occupancy of beds in the emergency, but it's part of what the population can do to help us. In the meetings, we talk about flow of hospital flow. How can we take people out of bed? How can we treat people without using a bed? Can we get them out of the hospital faster? What can we implement so that we have more access to bed? Those are the discussion we have in our meetings. But yes, we did pass on. We just asked the population to help us a little bit too.
So that is Gilbert Boucher. He is head of the Federation of Medical Specialists of Quebec. He was part of that press conference today with Christian Dubé, where we learned, and I think this is important, we talked about COVID not being gone, but now it seems the big worry, if I read this right, Aaron Derfel of the Montreal Gazette, their health reporter, is on the line. Aaron, it's the flu. What are we seeing? 250 people a day now coming into hospitals with the flu?
Yeah, exactly. Well, not just the flu. Mostly the flu, followed by other respiratory infections like RSV. But COVID is also responsible for 50 hospitalizations via the emergency room. So that struck me as somewhat of a surprise, because I was looking at in preparation for the news conferences, I was looking at the latest influenza report by the Quebec Public Health Institute, and it seemed to be showing a decline. But you have to be careful, because sometimes you have like a false decline, and their models are projecting possibly a peak later this month, and it just underscores the enormous pressure that our very fragile system is already under.
So based on what you heard today from Christian Dubé, we sat and looked at each other after hearing this thing and went, okay, I've heard this over and over. There was nothing new in there today.
The messaging that to just not go to emergency,
and
it's
blaming
not working.
patients for going to emergency who shouldn't be there in the first place. We've heard this over and over and over. Was there anything new in there today from what you heard?
Well, apart from addressing that, right? And so Gilbert Boucher did offer a qualified apology, and he offered this veiled criticism of his colleagues in Vancouver who might not be facing the same kinds of ER pressures as Quebec is facing. I believe that to be true. We also learned that this is a higher flu uptick than expected. I was somewhat surprised that they appear to be downplaying COVID. And the message that they delivered today, which I thought was stronger than back on December 19th, was go get your flu shots, and you can get flu and COVID shots. So, there's still, I think at one point he was saying like 50%, it depends on the age bracket, but I think 40% of Quebecers above the age of 70 haven't gotten their flu shots. Mm-hmm. And Dr. Luc Boileau, who's the public health officer, was saying, the antibodies can kick in even after several days. It's not too late to get a flu shot.
Again, part of the problem here, we heard this before too, was the slow uptake. And I can't ask you to try to explain why people have not been doing this or following through on this. I kind of wonder if it's a matter of telling them, hey, flu, really bad this year, and maybe that will spur people to get their shots?
Exactly. I think the message was quite muddled. And I think that, unfortunately, Christian Dubé descended into bureaucraties. He was talking about P4s and P5s versus P1s and P2s. This is the Canadian triage scale. So, someone who's a P1 has to be seen immediately. They're in a life and death situation. And P4s and P5s, they can wait a little bit longer. But they didn't explain that well. And, asking the public to self-diagnose is frankly absurd. And what we're seeing is a combination of two things, that that there's a lot of respiratory virus circulating, different strains, different types, and so people are showing up because they're very, very sick, and they can't self-diagnose, and then finally they're going to ERs because there are not enough family doctors, there are not enough clinics, and so they feel that the ER is the best option for them.
No one wants to go to the ER, and I feel like this is a point that's being fundamentally missed. You go to the ER out of sheer desperation and because you're scared. And the messaging here, as you said, when he went into those, like the forms and stuff, and then you wonder why the message isn't getting across to the public. It's right there. You're not striking the chord of, okay, I understand that you're scared. This is this is what you should do instead, and make it actually functional for them. But beyond that, just any kind of empathy. I felt like that was so sadly lacking, Aaron. Like that, no sense that the public is scared and don't feel like they have anywhere to go but ER.
I think it's fair to say that Christian Dubé is flailing.
Yeah.
This was a news conference that went in many different directions. He digressed and started talking about Bill 15 and Santé Quebec and saying this is not a structural reform. He was criticizing journalists for dismissing his reform as just structural. And yes, there was that lack of empathy. And he didn't mention these winter clinics. Maybe he didn't mention them because there's just 3 of them in Montreal. These are family medicine groups that are now open longer hours. But again, it's just the messaging. They should be taking out ads in newspapers. There should be radio campaigns to make the public aware of the options that are available. And I just haven't seen that happen.
That's
I think they dropped the ball.
That's a fascinating point. We saw so much of that, right, during the campaign, and then boom, gone. Even though we know COVID's not gone, flu's not gone, numbers are up. Yet you're right, the government, that messaging simply hasn't been there. I haven't heard it.
Are Christian Dubé's days numbered? Because I'm getting a little inkling of that.
I think he, a few years ago, he wanted to quit provincial politics, and so he's taken on the toughest portfolio, and he's under tremendous pressure, and he's got to implement Bill 15. But I think that he has the confidence of the premier. We'll see what happens. I don't think he's he executed any major gaffes. Like his predecessor, Daniel McCann, and what he's betting on, we'll see the results of Santé Quebec. I had a story the other day in the paper. They're going to be paying the CEO $543,000, and which is they're paying Michael Sabia, who's the CEO of Hydro-Quebec, $650,000. The head of Lotto Quebec is getting $450,000. And again, he's just betting that this new agency will be able to turn things around. I have my doubts.
Did that come up at all? Did you hear anybody ask about that today? Because the first reaction when you wrote the piece was people are like freaking out, thinking we're paying some of that kind of money to run Santé Quebec. Forget about the fact that it's administrating 300,000 people. Did it come up today? Anyone bring it up?
No, it didn't come up. And Radio-Canada, which broke the story, walked back one element. That the CEO would have a chauffeur and a car. Apparently, he or she is not going to have that luxury.
Yeah.
But that person will be making more than twice the salary of the health minister, and Luc Palot, the chief public health officer, combined.
Wow.
So it's a lot of money, and so they have to show the results.
Not a job. I can't imagine. It's going to be very curious to see how. I hate to say it this way, and I hate to even bring his name up. I think back to Arthur Porter when we were talking about building the MUHC to begin with, right? And the executive search that turned up. I wonder who's going to want to come here and take on that job in a system that is basically as, I hate to say it, as broken as it is now. This is going to be very interesting to see. So, Aaron, thank you very much. Go ahead.
No, I agree with you, Aaron. It's a tall order.
Sure is.
Very.
Even for that kind of money. Aaron Derfel, Montreal Gazette health reporter. Aaron, thanks. Appreciate it as always.
My pleasure.